Attention is one of the most fundamental psychic functions for mental functioning. It allows the individual to select relevant stimuli, maintain mental focus, and organize conscious experience. Without attention, thinking becomes disorganized, memory is impaired, and perception loses clarity. There are different types of attention. Voluntary attention occurs when we intentionally focus on a task or object. Involuntary attention is automatically captured by intense, novel, or emotionally significant stimuli. We can also describe sustained attention, divided attention, and selective attention, all of which are essential for everyday functioning. Alterations in attention are common in many psychological and psychiatric conditions. In anxiety disorders, attention often becomes excessively focused on perceived threats. In depression, there is usually a reduction in concentration and mental energy. In neurological conditions, individuals may struggle to maintain attention for extended periods of time. In clinical assessment, attention plays a central role because it directly influences other psychic functions. Impaired attention compromises memory, thinking, and the ability to act in an organized and goal-directed way. Understanding attention is essential to understanding how the mind filters information and constructs a coherent experience of reality. Orientation is the psychic function that allows a person to recognize themselves, their environment, and their position in time. It is commonly divided into 3 dimensions: personal orientation, spatial orientation, and temporal orientation. Personal orientation refers to the awareness of one's own identity. Spatial orientation allows the individual to know where they are. Temporal orientation involves awareness of the date, time, day of the week, and life period. Disturbances in orientation are clinically significant and are frequently observed in delirium, dementia, and acute psychiatric or neurological conditions. A disoriented person may not recognize their surroundings, or may confuse past events with the present moment. In clinical practice, assessing orientation is one of the first steps in a psychological or psychiatric evaluation. It provides important information about the level of consciousness and mental organization. Loss of orientation severely affects autonomy and daily functioning. Orientation depends on the integrity of other psychic functions such as attention, memory, and consciousness. For this reason, disturbances in orientation rarely occur in isolation. Memory is the psychic function responsible for registering, storing, and retrieving information. It is essential for learning, personal identity, and adaptation to the environment. Memory can be divided into different types, including immediate memory, recent memory, and remote memory. Immediate memory allows the retention of information for a few seconds, while recent memory involves events from the past hours or days. Remote memory refers to long-term memories from earlier life periods. Memory impairments are commonly associated with neurological disorders such as dementia, but they also occur in depression, anxiety, and situations of intense stress. Excessive forgetfulness can interfere with academic performance, professional activities, and social relationships. In psychopathology, memory assessment helps differentiate clinical conditions and understand how mental illness affects daily life. Memory is not a passive storage system but an active process of reconstructing experiences. Understanding memory is essential to understanding how past experiences shape present behavior and guide future decisions. Thinking is the psychic function responsible for organizing ideas, forming concepts, making judgments, and solving problems. Through thinking, individuals interpret reality and make decisions. Disturbances of thinking can affect either its form or its content. Formal thought disorders include disorganized, accelerated, or impoverished thinking. Content disturbances may involve delusions, which are fixed beliefs that are not consistent with reality. Language is the primary means through which thought is expressed. It includes the ability to speak, understand, read, and write. Alterations in language can impair communication and may indicate neurological or psychiatric conditions. Thinking and language are deeply interconnected. Evaluating these functions is essential for understanding how individuals structure their internal experience and communicate with the external world. Changes in thinking and language often provide valuable clinical information and play a key role in psychological and psychiatric diagnosis. Mood and affectivity are related to the emotional dimension of mental life. Mood refers to the predominant emotional state, while affectivity involves the capacity to experience and express emotions appropriately. Alterations in these functions are central to many mental disorders. In depression, mood is persistently low and interest in activities is reduced. In bipolar disorder, mood may fluctuate between states of excessive euphoria and deep sadness. Will is the psychic function related to initiative, motivation, and the ability to act. When will is impaired, individuals may experience apathy, lack of initiative, and difficulty making decisions. The study of mood, affectivity, and will helps explain how emotions influence behavior and daily functioning. These functions are closely linked to quality of life and mental health. Throughout this series, we will explore each psychic function in greater depth. If this content was helpful, subscribe to PsychoMinds, like the video, and continue learning psychology based on science.